Good afternoon, everyone. My topic is prevalence and clinical profile of glaucoma in rural-based tertiary care hospital. I have no financial disclosure. So glaucoma is the second leading cause of world blindness with global prevalence of 3.54%. Prevalence of glaucoma in Southeast Asia countries is more, also in India also. So glaucoma studies in India have shown increasing age, high IOP, hypertension and diabetes as some of the risk factors for glaucoma. Considering scarcity of glaucoma studies in rural area of Western Maharashtra, this study was conducted to find out prevalence of glaucoma and its risk factors with aims and objectives of to estimate the prevalence of glaucoma and clinical profile of glaucoma in rural-based tertiary care hospital. This was the hospital-based cross-sectional study conducted in ophthalmology OPD in a rural-based tertiary care center. The sample size was 583 calculated using the following formula with 95% confidence interval. All patients above 18 years of age reporting to ophthalmology OPD willing to participate in the study were included, and those who were having juvenile glaucoma or congenital glaucoma were excluded from the study. Socio-demographic information was recorded. Detailed history covering personal history, occupational history, history of any comorbidity and drug history was recorded. All patients underwent ocular examination including best corrected visual acuity, slit lamp examination, stereoscopic optic disc evaluation, fundus examination and IOP measurement with Goldman applanation tonometer. Suspected glaucoma cases on clinical examination underwent further glaucoma workup such as gonioscopy using Sussman 4 mirror gonioscope, and the angle was graded by modified Schaeffer's classification. Vertical cup disc ratio was measured and noted. A visual field examination was done using CETA 24-2 program on Humphrey's visual field analyzer. Optic nerve head glaucomatous changes were captured using OCT glaucoma scan. Operation definition is as follows: glaucoma diagnosis by any of the following three features like high IOP, significant disc changes and glaucomatous field defect. The data of the patients were tabulated and analyzed by SPSS software. So in results, in our study population, out of 583 cases, 42 cases had primary glaucoma. The overall prevalence was found to be 7.2%, out of which 90.4 cases had open angle and 9.52% was angle closure. So the mean age of the patient with glaucoma was 57.62 years. The prevalence of glaucoma was seen in elderly patient. Uh, there was no significant difference between the two sexes. The prevalence of glaucoma was found to be significantly associated with positive family history. All the patients who had positive family history of glaucoma were found to have glaucomatous changes. Out of 82 patients, 33.33% diabetic patient had glaucoma with significant p-value. Similarly, for hypertensive patients, the prevalence was 38.09 with significant p-value. IOP recording was available in all 583 cases. The mean IOP in both eyes was 14.42 mm of mercury. One or more disc features suggestive of glaucoma were seen in 61.90% of cases. Bilateral glaucomatous optic disc atrophy was seen in 2 patients and pale disc was seen in 2 patients. The loss of RNFL nerve fiber layer, RNFL thickness was seen in all 4 quadrants in 5% of cases, in 3 quadrants in 53% of the cases, in 2 quadrants in 4% of the cases, and only in 1 quadrant in 26% of the cases. Visual fields, the mean deviation, the mild mean deviation seen in 78% of the cases, moderate mean deviation in 18% of the cases, and advanced mean deviation in 4% of the cases. There are not many studies comprising the automated perimetry and gonioscopy for confirmatory diagnosis of open angle and angle closure respectively. Hence, this study was conducted incorporating this examination. The prevalence of glaucoma was found to be 7.2% in our population of western part of Maharashtra in our rural-based tertiary-based study. The glaucoma prevalence rate was in our study was comparable with Vellore study. However, the population in our study was rural, whereas the population in Vellore survey was primarily urban. Increase in the prevalence of glaucoma with advancing age has been reported in several studies. A positive family history of glaucoma is a known risk factor for future glaucoma. We also observed a strong correlation of glaucoma with positive family history. So in conclusion, our study highlights a high prevalence of glaucoma in our field study. Its association with increasing age, positive family history and history of angle closure may give us indication for early detection. Screening for glaucoma during middle age, especially among persons with a positive family history would help us early diagnosis and management of this irreversible disease. Being the most common irreversible cause of blindness, early diagnosis and management of glaucoma would yield a better prognosis.